生嘅診所又開始新嘅一日。今日佢會同我哋展示動物身體入邊嘅情況。
This is an amazing little product. It's brand new on the market and we're using it. It's excellent. We call this a little alley cam. It's a camera inside a capsule. And what happens is it video records 360 degrees around it. So as you put it in the mouth, the animal swallows it. It goes through the stomach, through the small intestine, through the large intestine, the rectum, and then it poops it out. And then for 24 hours this thing records. With the normal traditional ways, you have to go through anesthesia, you have to have a proper medicine, you have to have doctors waiting with the animal, nurses waiting with the animal, put a tube in the mouth and check the stomach, and then do your endoscope. Whereas the alley cam, you just pop it in and it's like a tablet. It's like eating a little tablet, like a sweet, and then he just poops it out. That's around, and you can see the whole picture.
And then I pop it into the machine here. So all in all, the whole capsule ran inside of her for 16 hours and 24 minutes and 40 seconds.
And then we can see where there's a problem, if it's a polyp, if it's worms, if it's cancer, if it's a tumor, if it's anything like that.
Now we will send this off to the specialists in the US, and they will then analyze the sample, and then they'll send it back and they'll send us back a report, and then Dr. Ruan will be able to see what all went on in Fermoy.
So anywhere in the body where there's a problem, we can see it. And then we decide what we're going to do with it. We're going to decide if we're going to go for surgery, if we have to go for treatment, what we have to do. So this is an amazing little product. It's brand new on the market and we're using it. It's excellent. So let's see what the results are for this little thing. They're just showing you that there's a little papilla of the duodenum and then it's irregular mucosa. So the mucosa means the skin of the intestine is not normal because of maybe too much ulceration or too much acid in the stomach or too much inflammation. It's very fast, very efficient, and you don't waste time with this one. We don't like to waste time, so this is excellent to use. Great diagnostic tool to have.
由大至小，唔同體型嘅動物都會嚟到 Ruan 醫生嘅診所求診。
At the bearded dragon, his left hind leg was just limping, just flabby. So I thought maybe it's broken, maybe it's like cracked, because usually we have problems with this. The bone becomes thin, brittle, and with any sort of compression or too much pressure on the bone will break. Especially with this little guy, he's overweight. So we took him upstairs for x-rays, and in the x-ray I can see that the cortex of the bone is really thin. So it should be nice and thick. So it already tells me that this got MDB, metabolic bone disease. So he needs to increase the calcium in his food, increase the phosphorus in his food. And then you can also gut load your insects that you're feeding. So you'll have, for instance, a bucket of crickets or a bucket of cockroaches or a bucket of mealworms. You need to gut load these animals. You need to feed them before you feed them to your pet.